Have you heard of edging? Today, we're talking all about it, what it is, how it works, and whether it's safe or beneficial. I'm Dr. Emma Blake, urology and men's health expert. And if you're new here, I create videos that help men take control of their sexual health, performance, and confidence without shame or confusion. Let's dive in. Edging is a form of orgasm control. It means getting close to climax, then stopping or slowing down to delay ejaculation. This can be done alone or with a partner, and it can be part of any type of sex, whether that's oral, anal, or penetrative. But why do people do it? What are the benefits? Let's start with the pros. First, edging may increase pleasure. By delaying orgasm, you build more sexual tension, and that can lead to a more intense release when climax finally happens. Second, it can help deepen intimacy with a partner. If you're both exploring edging together, it gives you a chance to communicate, sync your timing, and share a different kind of experience. For some couples, this creates more emotional connection. Third, edging helps you learn your body. When you edge, you become more aware of which types of touch and stimulation are more or less pleasurable. This can help you understand your arousal better and potentially give you more control in the long run. Fourth, edging can extend the duration of intercourse. For many men, learning how to delay climax means they can last longer, which often improves satisfaction for both partners. And finally, it's a technique we often recommend for men dealing with premature ejaculation. Edging can be practiced using what's called the stop-start method, where you pause stimulation when you feel close to climax, wait 30 seconds, then resume. You can also add a firm squeeze at the base or head of the penis to help delay orgasm further. So, does it actually work? While research on edging for general pleasure is limited, we do have data from studies on premature ejaculation. One study looked at 36 couples. They compared men using the classic stop-start technique versus men using other delay methods without stopping sexual activity. Before training, most of the men were ejaculating in under a minute. After practicing edging techniques, the average time to climax increased to 7 minutes. That's a significant improvement, and it shows just how effective these methods can be when practiced consistently. Now let's talk about what your body does during sexual excitement and how you can gain more control. As arousal builds, your muscles start to tense, especially your abs, pelvic floor, and glutes. Your breathing speeds up. Thrusting often becomes more intense. Your attention narrows, focusing entirely on sensation. To delay orgasm, the key is to slow down this buildup. Researchers suggest using diaphragmatic breathing, also called belly breathing, to help relax your muscles and extend the arousal phase. Instead of chest breathing, focus on filling your lower lungs and abdomen. This slows your breathing and softens muscular tension. You can also shift your focus to moderate, steady pleasure instead of going hard and fast. Enjoy the sensations. Don't just chase climax. And importantly, don't distract yourself with non-sexual thoughts. That may sound like a mental trick, but it often backfires, causing anxiety or disconnection from the moment. The goal of edging isn't to escape climax. It's to stay in the zone of pleasure longer, on purpose. So what are the downsides? Let's start with something called blue balls. This is a real phenomenon, also known as epididymal hypertension. When arousal is sustained, but orgasm doesn't occur, blood can remain pooled in the pelvic area, leading to aching or discomfort in the testicles. This usually goes away on its own, but it's something to be aware of. The second risk is idiosyncratic masturbation, meaning you become too accustomed to one very specific kind of stimulation. If you edge frequently using your hand or a particular toy, it can sometimes make it harder to climax during partnered sex. The sensations may not match what your body is used to, which can lead to frustration or difficulty finishing. A third issue is delayed ejaculation. While edging trains you to last longer, for some men it can become too effective, making it harder to climax even when you want to. If this creates anxiety or starts to interfere with your enjoyment, it may be worth taking a break or trying other techniques. Communication is key, especially if you're edging with a partner. Make sure you're both on the same page, comfortable with the experience, and clear about your goals. Now, how long should you edge? There's no magic number. It really depends on you. Some men aim for 7 to 9 minutes. Others might edge for half an hour or more. As long as it doesn't cause discomfort or interfere with your life, there's no strict limit. But if you start experiencing chronic pelvic tension, pain, or feel preoccupied with edging in a way that affects your mood, relationships, or daily function, talk to a healthcare provider. That's rare, but it does happen. And what happens if you edge but never ejaculate? Don't worry. Your body has a plan. The semen is either reabsorbed or released later, often during sleep through a nocturnal emission. It won't build up or cause harm. So, is edging safe? For most people, yes. When done mindfully and in moderation, it can increase pleasure, improve control, and support healthier sexual function. Just stay aware of how it's affecting your body and relationships. And if you're looking for a way to enhance your results, especially when it comes to blood flow and stamina, there's one natural tool I recommend. It's a supplement made from watermelon extract, one of the richest sources of L-citrulline, a compound your body uses to make nitric oxide. Nitric oxide relaxes blood vessels, boosts circulation, and supports stronger, longer-lasting erections. It's the same mechanism many performance-enhancing drugs use, but this one comes from nature. The supplement I recommend delivers clinical doses of L-citrulline in capsule form. No juicing, no sugar, no mess. It's ideal for men over 50 who want better blood flow, stronger performance, and more confidence, without relying on prescriptions. You can find the link to the watermelon extract I trust in the description below. And if you'd like even more value, check out our channel memberships. As a member, you'll get early access to new videos, ad-free content, exclusive Q&A episodes, and priority replies to your questions in the comments. It's a great way to support the channel and dive deeper into topics like sexual health, prostate care, and men's wellness, with content tailored just for you. If you found this video helpful, make sure to subscribe for weekly tips on sexual health, prostate care, and performance over 50. And if you think someone else might benefit, share this with them. Because when you understand your body, you can take control of your health, and you deserve that. I'll see you in the next one.